Hello and welcome to all of our viewers here today. I'm Kristen Schwartz, licensed midwife and MC here at GOLD. And I'm here today with a special guest, Dr. Aruna Savur. Welcome, Aruna. It's lovely to have you back here at GOLD.
Thank you. So happy to be back.
Here at GOLD, we're getting ready for a brand new lecture pack, and it is very near and dear to my heart as a midwife. And the lecture pack is called Comprehensive Care for 6 Newborn Challenges. You are going to be presenting on jaundice, Aruna. But before we get talking about that, I would like to know, first of all, where in the world are you?
I'm in Bengaluru, Karnataka, India.
Beautiful. Thank you for sharing that. It's just lovely to have experts from all around the world here teaching us and learning. We can learn from them in our presentations and our lecture packs. So I'm very happy to have you here today and that.
Thank
Now,
you.
before we talk about the presentation, tell us a little bit about your background. You are a pediatrician, if I'm correct. Tell us a little
Yes.
bit about all that you've done and what you're working on now today.
Okay. So I've been a pediatrician for about 25 years now. I was in private practice in a very small town, and then I did my fellowship in neonatal intensive care. I worked in an NICU for a couple of years, and then I realized I was more interested in supporting the parent because the babies were already very well supported. So then I qualified as IBCLC, and I also learned infant massage. So I feel a bringing together of all the things that I am interested in, I'm able to support the mother and the baby better.
Sounds absolutely wonderful, Aruna. I love how you have this holistic approach, right? You're a pediatrician, you worked in the neonatal ICU, but also you're supporting the mothers, the families, you're an IBCLC, so a board certified lactation a consultant there, and infant massage. So you're bringing this whole picture, this whole package together here, supporting the entire family. Absolutely love that. And I know you're very specialized also in infant feeding, when it comes
Yeah.
to lactation and breastfeeding, right? You're very passionate
Yes.
about that as well.
Yes. Yes, I am.
Wonderful, wonderful. And I love how you support the families. Now, talking about jaundice, and your presentation here is titled Creating a Care Plan for the Jaundiced Newborn. Very, very important presentation, but I have to also ask you, jaundice, often we see it as something a little bit benign, right? We see, oh, many babies get it, especially in the beginning. Let's just breastfeed them and take them outside, and then we're good to go. But that's not always the case, right? And I
Yeah.
feel like this is where your presentation comes in, because shining a light on this important topic. So tell us a little bit about it.
So physiological jaundice is very common in babies and it is harmless and temporary. But if we tend to dismiss every kind of jaundice in every kind of baby as being physiological and that it would go away on its own, we are setting ourselves, the baby and the families for the risk of brain damage, which can be permanent. Therefore, it's very important to take jaundice very seriously and also to take the parents' concern very seriously. So what I do find is parents are sometimes their concerns are brushed away. We tend to tell them, oh, you just need to feed your baby better, or it is going to take some time. And we don't equip them with enough information, which I find is such a big drawback. So educating the parent and making sure that we educate ourselves so we know when to monitor and how to intervene, that is the way to go to prevent kernicterus.
You brought up a very important topic, educating the parents as well, right? And often as healthcare providers, especially in the newborn period, there is a lot that we give the parents to consider, to think about. So especially in the beginning, there's a lot to look after, right? How do we do this in a way that we don't scare the parent, but make sure that they get a good, solid education and information?
Correct. So I think a lot of preventing jaundice would depend on start in pregnancy itself with the screening and also very good breastfeeding support. And at discharge, we need to give them the correct information about what their baby's jaundice level was, what the plans for the baby is, and what red flags to look out for. Rather than dismiss it as being entirely normal and temporary, we need to equip them with information so that they know when to come back if the baby is not feeding well or if the other signs appear.
Yeah, that is wonderful. Thank you for that. Another question I have for you is, as healthcare providers, we are taught often to blanch the skin a little bit and see if the skin changes. Now, how reliable is this really as a method of detection?
Not really reliable because some babies can be dark skinned, or if you're checking that baby under, say, artificial light, or if there's some orange or white cloth, it can confound you. Or if the baby has had phototherapy and the skin is blanched, then again. And there's so much variability. Like if you were to check, you would get a certain level. If I were to check, it would be another level. So it's always very important. If you find that a baby is jaundiced by visual inspection, you always need to get a blood test done.
I have to be on the safe side, right, Aruna?
Yes, yes.
Absolutely. Well, thank you so very much for sitting down here with me, talking about the presentation on this so important topic. I can't wait to learn from you and learn more about this topic and better serve the families I see as well. So thank you so much, Aruna.
Thank you, Christine.
And now for our viewers, if you're interested in Dr. Aruna Savur's presentations and the entire package here of comprehensive care for 6 newborn challenges, we invite you to go to goldlearning.com. And this package will be an add-on package for our upcoming midwifery conference, goldmidwifery.com. You can find out more about this conference as well. So we hope to see you at the conference and check out this amazing lecture pack as well. Thank you, everyone, for watching here. And thank you, Dr. Aruna Savur. Bye-bye, everyone.
Thank you. Bye. Thank you.